Hello, this is Dr. Trivedi. May I start?
Okay, start.
Hello, this is Dr. Trivedi, a doctor working in this clinic. May I confirm that you are Alexander Daddario, 78 years old lady's daughter?
Yes, Dr. I am.
Yes. Uh, well, may I actually? I'm here to talk about your mother's health issues.
Yes, Doctor. I asked one of your nurses to make an arrangement with you, so so that I get better information about my mother's condition.
Yes, and actually, I'm here to talk with you about that. Uh, uh, and are you all right if we talk more about your mother's condition today?
Yes, Doctor. I really want to know that.
Yes, yes. May I at first, before beginning our conversation in details, uh, may I seek your permission that during our conversation I might take down some notes, which will be strictly confidential. Will that be okay?
Okay, Doctor.
Okay. And may I at first know that how far are you aware of your mother's condition?
Okay, Doctor. She had some issues with her breathing, and this is not a new thing. She was admitted several times before to this hospital with this type of problem, and this time also she has this breathing problem, and for that she is admitted to a hospital, and she's receiving the treatment. And I think the doctor said that she had a condition that is called chronic obstructive pulmonary disease, they said, or COPD. And they also said that this was a severe condition.
Yes, yes. May I know that did you have any idea of this disease before, or did you just know this time that she is suffering from COPD?
No, we knew it a long time ago because we have to take her several. We have to take her several times to the hospital.
Yes. And okay. And this time she also got herself admitted due to this condition. And may I know that does she live alone, or do you accompany her, or anyone accompanies her at home?
She lives with me, doctor.
Okay.
I am
And
the
then
only caring person of her.
yes, yes, I really highly appreciate you. May I know that what was she prescribed while being at home? What medication? Do you have any idea of it?
Yeah, yes, doctor. I gave her medication every day. She was taking inhalers, 2 inhalers daily, and also she needed oxygen at home.
Okay. And for how long did she have to take this oxygen? May I know?
For about last 3 years, her condition was getting worse day by day. So doctor
Yeah.
prescribed her oxygen.
Okay. Okay. Actually, I would like to say that at this moment, since her admission, we have been treating her with the best treatment that we have, okay, by giving her some medication and also some nebulization and etc. But I'm sorry to say that we don't see that her condition is getting improved up to the mark. Are you getting me?
Wait, doctor, what are you saying? That every time we admitted her, she got better. And this time she is not getting better. Is there any
Yes,
problem, or is there anything that we can do this time?
well, actually, may I add that actually, uh, do you have any idea about this disease, COPD? Were you briefed any time about this disease?
Yes, doctor.
Okay.
Previous doctor said that in this type of condition, lungs get scarred and lung cannot provide oxygen as we require during normal time.
Yes. And uh, do you had any idea about the course of the disease? What may happen later on, while if a person has this disease? Were you briefed about it?
Previous doctor said that stopping smoking will solve this process. So she stopped smoking and said that if she gets any time worse, then she needs hospital admission. And after getting hospital admission, she would likely to be get better.
Yes, I get it. Well, actually, what we are told was correct. It was nothing wrong. But may I add something more about the disease?
Okay, doctor.
Okay, actually, this disease it can be a progressive one. Okay, that it can all go on worse to worse day by day, despite getting all the treatment. Okay, what you were told was correctly all right to stop smoking. Actually, smoking uh, actually helps to control the rate of damage. Are you getting me in this
Yes, doctor.
condition? Yes. So that was correct. But it is also true that this condition actually can get more and more harmful day by day as the day progresses. Even if we continue all the treatment, this can happen to many patients. Are you getting me?
Yes, doctor.
Yes. And I'm sorry to say that we suspect that almost the same thing also has happened to your mother. That despite of getting all possible treatments, I think her lung condition has uh, getting worse. Okay, are you with
So,
me?
doctor, I can understand your condition. So, isn't there anything that you can do at this point?
Yes,
I heard
I'm
that there
getting
are
to it.
some nothing machine ventilation, that
I'm getting to
something
it.
like
I'm
that,
going
and
to it.
that can help.
Yes, yes, I'm going to it. At this moment, actually, uh, we my, we think that there can be uh, a breathing machine, okay, that might help your mother out. That might. We are not completely sure about it, but there is an option of it. Okay. Uh, do you have any idea about that breathing machine or something like that?
No.
Okay. Would you want to have any idea of it?
Yes, doctor.
Yes, actually, in this breathing machine, we actually introduce a tube through the windpipe, and the tube is also connected to a machine outside. Okay, through this machine, we help the patient to breathe. Are you getting me?
Yes, doctor.
Actually, this can be a condition. This can be an option. This could have been an option in this in your mother. Okay.
Doctor, you can go whatever you think that what is best for her, because we I just want to see him well, see her well.
Okay, okay, I can get it. I can get it. Well, actually, at this moment, I'm very sorry to say something about a decision of your mother, which is actually a very personal decision of her. May I proceed?
Doctor, what are you talking about? You can go for the treatment. Is there any hindrance to that?
Yes, actually, I'm sorry to say that actually in previous episodes while she was admitted, we she was quite able to make decisions, and actually at that time we discussed with her at large about this option. Okay, about this treatment option. So, but I'm sorry to say that she actually didn't allow us to uh, do this on her. Are you getting me?
Okay, doctor. So what do you mean?
Actually, I'm sorry to say, but I mean that she refused to take this breathing machine if even if she gets worse. And
Okay,
I'm sorry.
doctor. She made this decision in the past, but now her condition is getting worse. So you can go for that, and you please do whatever is possible with you. And I have no objection. I just want her to see a bit in a better condition.
I can get it. I can get it. But actually, I'm very sorry to say that your mother, when actually it's a patient's right to refuse or accept any treatment. Actually, okay. I'm sorry to say, and At that moment, your mother was fully capable, and um, we discussed her with her at large that what could happen later on, that her breathing can get very very worse and she might be at a life or death condition also. And we rechecked her with her whether she wanted to proceed with this uh, treatment. And actually, we discussed the pros and cons of it. There can be some risks associated with it as well, some good things, some bad things as well. And she listen after listening to all these, I think she actually refused to take the treatment in case in this type of if this type of situation ever even came. Are you with me? Are you
Yes,
getting?
doctor. I can get you. And you are saying that you will not give her this treatment.
Well, actually, at this moment, I'm sorry to say that uh, actually it's a patient's complete right that she can take it or refuse it. And actually,
Okay, doctor,
we are
it's I can understand that it's her right to take or refuse it, but it is also your right to give her the best treatment. And you told me that at this condition giving tubation is a better option. But why aren't you providing her the better management option?
actually we
Meaning,
actually yeah, actually we can propose our treatment from, and we can actually discuss our treatment uh, facilities with our patients. But if a patient is mentally capable at the time of taking decision, she can actually refuse or accept any treatment. And I'm sorry to say that actually she went not to when with the decision not to take this treatment actually. And may I assure you that actually although we will may not be able to give her this treatment, but we won't actually give up on her. Okay, and we will actually try our level best to treat her and to make her as much as
okay,
comfortable as
doctor,
we can.
aren't you thinking that without this tubation she will die soon?
uh, Actually, at this moment we might fear that if we don't continue this treatment, her breathing might get very bad, and she might not be able to survive as well. We
Okay, doctor, you're disappointing me. You are thinking that giving her tubation will help her, but you are not going for that. That
Well, actually,
you can understand, and you can also see she is a old lady. She is a poorly lady. She just made the decision once, and you are relying on that, and you are not going to give her the best treatment option. Is it because she is very old and she is not valuable to you?
no, there, I'm very sorry to say, but it's nothing like that.
Time up.
Actually, okay.
So what was it to ask?
Uh, my task was to make her understand that that her mother's decision must be respected,
And what decision?
not to take intubation.
Okay. And what was the scenario?
The scenario was that she was admitted with COPD and her condition is getting very severe, and at this moment, intubation might be needed or might be well. But actually, she refused it previously when she had full capacity, mental capability.
Okay. And what do you think? Have you been able to convince her, or have you been able to give her the proper explanation?
I'm sorry to say that I don't think I have been able to convince her. Okay, although I told about it, but I don't think that she was fully convinced with my dialogue, I think.
Okay. And was there anything that you should have or you could have asked if you had time?
Yes, I think I could have asked that. Yes, I should have asked a very important thing, that whether she had, even after giving her decision, even if she had given any advance directive or appointed any lasting power of attorney
Okay.
in this case.
So I can start now.
Yeah, you can just tell about the flaws.
First of all, you introduced yourself. That was fine. After that, you have uh, told about the agenda that you are going to do. Okay, that was fine. Uh, at that point, you should have asked about if she has seen her mother recently and what is her thinking about her mother's condition now. So you
Mm,
have asked, have you, okay, how far do you know about your mother's condition? Have you seen her before our conversation, or when you
mm,
seen her last, and what do you think her condition?
mm, mm, mm,
Then she would say, okay, I have seen her a few minutes ago, and after seeing her, I thought that she is not improving well, so I wanted to talk to you.
okay. Mm, 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 mm,
Okay.
mm, mm,
And there was the agenda was given. Her daughter wants to talk to you.
mm, mm,
So you
mm,
could have introduced that I came to know that you want to talk to me
mm,
about your mother's condition. Rather, you said that okay, I want to discuss about your mother's management plan.
mm, mm, mm.
But
Okay.
you are going to give your uh,
Okay. Yeah. I can get it.
but there was the patients, that main task was patients parties wanted to talk.
Mm, 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 yes, I can get it.
Okay, after she has told you that I have seen her with this condition, she is not improving, then you could have said, okay,
Mm,
what do you think, or do you have any idea that if her condition isn't improved with this type of treatment, what would be
mm,
our next step?
mm, mm,
Or a patient's daughter would say, okay, what can you do now, etc.
mm, mm,
After that, you should have said this, but you haven't said it, and you rather lost your time explaining this COP.
mm,
That
mm,
was not your task.
mm, 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 mm. Yes.
And at that point, you would say, okay, I don't have any idea.
Okay.
Okay, there are a few options that can help you in this, that can help her in this situation,
Mm,
but that's not absolute that that will help her.
mm,
Like giving her artificial or machine breathing.
mm,
And
mm,
you would say, okay, I heard it. Why don't you go for that?
mm,
Okay.
mm, mm,
Then you could say, okay, before I give you answer, can I ask you a few questions? Okay.
mm,
Your mother ever had discussed any advance management plan with you, that what type of treatment she should be given, or what type of treatment she should not be given
mm, mm,
in
mm,
any respective situation? Then she would say no. Okay, then
mm, mm,
did she appointed anyone
mm,
lasting power of attorney, or did she made any will,
mm, mm,
any advance directive? No,
mm, mm,
I don't know.
mm, mm, mm.
Okay,
Okay.
and do you have any idea that
Mhm.
if she made any thinking or decision with our previous hospital admission, as you know that she had recurrent admission into this hospital, if she made any advanced decision that what
Mm.
uh,
Mm.
treatment should not be given to her,
Mhm.
then
Mhm.
she would say
Mm.
no. Okay. At
Mm.
this point, we
Mm.
have actually discussed about the management plan and also discussed about the
Mm.
further management plan that if her condition worse, then at that point what
Mm.
type of treatment should be given or could be given.
Mhm.
And we also discussed about this type of machine ventilation with machine breathing
Mm.
with her.
Mhm.
Okay. And we told her
Mm.
all the good points, all the pros and all the cons. And
Mm.
after
Mm.
hearing all those, she made decision that she would never go for this type of
Mm.
artificial machine breathing.
Mm. Mm.
I am sorry to tell you that this decision was made by her own.
Mm.
Do you
Mm.
get me?
Mhm. Mhm.
And then daughter would say, okay, I can understand that she will not go for machine ventilation. Then why
Mm.
aren't you doing this time? Okay, before I get give you the answer, can you please tell me that do you know that after the previous admission, did he ever changed her mind or did he ever told anyone that she would like to withdraw her willing? Then she would
Mhm.
say, okay, no, I don't know.
Mhm. Mm.
After that, okay. At this
Mhm.
point, actually, we are giving her all the treatment that
Mhm.
give her in the ward, except those machine breathing,
Mm.
because this was refused by her. That's when she would say, "Okay, why this is a good, this is the good option. Why aren't you going for that? Whatever, etc." At that point, okay, is it okay if I tell you something about this machine ventilation? She would say, "Okay, okay, I can understand that you love your mother very much and you care for her, but we also discussed these good things and bad things, and also at this point giving her machine ventilation doesn't guarantee that she would get better, even she would
Mm.
get worse.
Mm.
And also sometimes after, even if she recovers from this machine ventilation,
Mm.
after recovering her condition may get much worse
Mm.
in the
Mhm.
future. And we
Yeah, yeah.
told
About this is all about medication, breathing machine
yes.
integration. Okay.
Okay, and we discussed her condition, and she say she after hearing all those, she made decision that she is not willing to go for it.
Yeah. Yeah.
And if she made any change with her decision, then we would go for that. Otherwise, we must have respect our decision. We cannot go against her decision because it is our uh, uh, we are bound to respect the patient's decision in any treatment. And I am sorry that I can also I can understand that you love your mother very much and you cannot accept.
Mm.
Uh, I think you should have also respected your mother decision.
Mhm. Mm. Mm.
At that point, she would say, "Okay, why aren't I going to force that? I am taking care of her and I will take care of her whatever she
Mhm.
goes
Mm.
through." Okay,
Mhm.
as she hasn't changed her decision and she made her decision previously with sound mind, and after hearing uh,
Mm.
all those outcomes, she made her decision on it. So we cannot go against her.
Mhm. Mm.
And then she would say, "Okay, I am. It's my fault. I should have present during the discussion, so I could have." I
Mm.
make her understood. Okay, at that point, you could say, okay, I can understand that you are blaming yourself, but actually it is not your fault. And
Mhm.
also at that point, whenever we made decision, uh,
Mm.
we reportedly asked our patient that this decision should be made
Mm,
made on her or on her own, not by any other's opinion, any other suggestion, or under any pressure.
mm, mm, mm,
So you shouldn't blame yourself. And
mm, mm,
I always respect and I can understand that you love your mother very much, and
mm,
thought that you cannot uh, bear this. But you should have also think about your mother's decision, because she made a
mm,
decision on a decisive manner, on a after hearing those. So she thought that it would be the best option for her, and I think you should also respect her decision. Okay.
mm, 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 mm. Yeah, I can get it. Mhm,
After that, you could have asked, okay, is there anything that I can that refusing that treatment doesn't mean that we are going to
mhm,
we are not
mm,
going to give her any treatment. We are actually going for all the other options, all the best options available, except that treatment, because your mother is specified that shouldn't be given.
mhm,
Without those, we are giving our best treatment,
mm,
and we
mhm,
are always monitoring her. If we can
mm,
do
mhm,
anything for her, we will certainly do that for her.
mm, mhm, mhm. Okay.
So, when do you want to add anything?
No, I didn't. I couldn't do this at all.
This was your first time, so there was something. We were going for the next phase.
Yeah.